A very good morning. My topic is ocular surface immune response in COVID-19 patients by studying tear cytokine expression. We know intense hypercytokinemia has been demonstrated in serum of critically ill COVID-19 patients. Ocular surface is a potential route of infection because of the presence of SARS-CoV-2 virus in the conjunctival swabs. But the immune response in tears has not been explored well in COVID-19.
Can I request you people to keep quiet?
Since tears can be obtained easily, repeatedly, and in a non-invasive manner, it makes sense to use them as alternative specimens to explore for biomarkers. And with our own experience of quantifying the viral load in COVID-19 patients, we hypothesized that the inflammatory mediators in COVID-19 could also be detectable in tears, and hence conducted this study to study the local immune response to SARS-CoV-2 virus by evaluating the cytokine expression profile in tears of COVID-19 patients and to assess their correlation between tears and serum. We enrolled hospitalized COVID-19 patients, 30 each with mild, moderate, and severe COVID-19, and 30 normal. Tear samples were collected from both the eyes, stored at -80, subjected to cytokine assay using flow cytometer, followed by data analysis. We divided the results into 5 subsections, coming to the first COVID-19 versus healthy controls. Coming to the age, the normal controls were much younger as compared to the COVID-19 patients. However, gender did not show any comparison, and the conjunctival swab positivity was not statistically significant. In serum, IL-2, IL-6, and TNF-alpha were significantly higher, and IL-4 and IL-17 significantly lower. Coming to tears, TNF-alpha was significantly higher, and IL-4 was significantly lower. When we compared both serum and tears, IL-6 was significantly higher along with TNF-alpha, and IL-4 was significantly lower in both serum and tears along with IL-17A. We found a parallel expression of a raised TNF-alpha and low IL-4 in both serum and tears, which was statistically significant. IL-6 was the most abundant cytokine, followed by IL-10 in tears of COVID-19 patients. Coming to the severity of disease, in severe group as compared to mild and moderate, serum IL-6 was higher, and also tears IL-6 was higher in severe group. Coming to the conjunctival swab positivity versus negativity, we did not find any pattern of cytokine expression. Duration of illness, we found that in serum that was collected in week 1, IL-2 was significantly high and IL-4 significantly low. And in tears collected in week 1, IL-17 was significantly high as compared to the samples that were collected in weeks 2 and 3. Coming to the correlation between serum and tears, there was a weak correlation among IL-2, TNF-alpha, and interferon gamma, and no correlation with the other cytokines. Coming to discussion, we found a high TNF-alpha and low IL-4 in both tears and serum. In severe disease, IL-6 was high not only in tears but also in serum. In early disease, that is in week 1, high IL-17A was found in tears, and high IL-2 and IL-4 was found in serum. This is the comparison of our study with previous only 4 studies which have been conducted on tears in COVID-19 patients from Spain, Poland, and Netherlands in 2020, 21, and 22. So the strength of our study is that ours is the first study of its own kind, not only from India, but also from Asia. It is the second study to compare the tear cytokines with serum. The samples have been collected across all severity of disease and duration of illness. We have few limitations of it being a cross-sectional study, studying limited number of cytokines, and COVID-19 may be a thing of the past, but is pandemic really over? If you look at the WHO websites, we have constant updates of new emerging infections fortnightly and even weekly, and not to forget the human metapneumovirus outbreak that was reported in Northern Hemisphere in the month of January this year. So there is a persistent risk by the emerging diseases, and the ophthalmologist may play a bigger role, be better prepared for testing biomarkers for disease outcome, because tears can be used as potential specimens in other immunologically driven systemic diseases. And we found that tears reflected an altered immune response of the ocular surface in COVID-19, which also changed with severity and duration of the disease. Thank you very much. I would like to acknowledge the residents of our department who were posted in COVID wards and helped in collection of these samples and funding by the Institute. Thank you very much.
Thank you very much, Reena. Any questions any of the judges have?
I think we understand. good.
All right.
Let's start to go on to the second.
Yeah, sure. Go ahead.
All right, thank you.
Thank you.